We'll go ahead and call the subcommittee for House Study Bill 5 order. Representative Thompson, we have Representative Fry, Representative Levin, and Mike here. We'll go ahead and start with you. Thanks.
So Mike Savala from the Mike Savala from the Department of Corrections. Thank you for allowing me the opportunity to speak on the bill. So essentially what it does is it's two things. It does not allow anyone placed on correctional custody or supervision to be issued a medical cannabis card. And then the second prong of the bill is anybody that has been issued a card that then is placed on correctional custody or supervision, the card would then be revoked. What's driving the bill is we have a lot of offenders. We have a very high percentage of our clients on correctional supervision that have substance abuse issues that are finding a loophole to go get a medical cannabis card in order to use the substance. From the Department of Corrections lens, it's our obligation to treat those folks under our supervision that have substance abuse issues, and that's really what's driving this legislation.
We'll go ahead and go around the room. Just tell us who you're here with and your position on the bill. We'll go ahead and start over here. Do you want to speak?
The Deputy Director for the Department of Corrections. Leslie Carpenter. I think that if somebody very well need it for something. On the other hand, certainly witness the right. So unfairly.
Thank you. My name is Dane Schumann. I represent MedFarm Iowa. We're officially registered undecided on the bill, but I guess do have a couple of concerns with it that I'd like to note. I guess overall, to the point that was made earlier, this about there being a medical condition that deserves treatment, and there's a physician behind every certification, or a PA or an ARNP that's behind every certification for a patient that has access to the program. It does seem to me to be not that medically defensible for the state to say that because you're under the supervision of the Department of Corrections in particular. I think being in custody might be a different story, but if you're under the supervision, i.e. under parole or probation under the Department of Corrections, that you suddenly can't have access to a medical program that your doctor says you should have access to, I don't think that strikes me as being very medically defensible. And what I would say, to maybe drive that point home is, 4 years ago, this body passed a reform to the Cannabis Act that removed the prohibition on felons being able to access the program. And I think that was a board recommendation from the Medical Cannabis Advisory Board. And the logic behind that recommendation was that regardless of your status, your criminal status, doctors treat patients as they find them in terms of what their medical conditions are. And so if there's a compelling justification for folks that are incarcerated in prison, I can perhaps see that. I don't know how, practically speaking, patients would be getting access to medical cannabis at dispensaries, which is the only place you can buy it right now if you're in custody at the Department of Corrections in prison. But that may be something I can learn more about. The other concern I have is just based on the first part of the bill, deals with the issuance of cards, not revocation, but issuance. And I don't know how the department that administers the program would necessarily be able to quickly identify whether or not somebody is or is not, particularly under the supervision of the Department of Corrections. And I fear that might get in the way of just everyday Iowans who aren't under supervision to be able to have a hard time getting a card. The third point I'd note is that there is a process in the administrative rules that was passed, I think 2 or 3 years ago, that we actually supported that would allow physicians who certify a patient to decertify them out of the program if they deem it reasonable or deem it necessary. There's really no questions asked to that. So there may be a process, if we're thinking about this, to allow physicians to have a say and to work with the department to say, look, someone is under our supervision and we think they've got an issue here. The physician can revoke that registration if they would like to. So right now, like I said, we're undecided on the bill, but it does raise some concerns for us.
Thank you, Representative Thompson. My name is Nick Crawford, Legislative Liaison with the Department of Health and Human Services. I can speak to the registration piece that Mr. Schuman brought up. So we had actually worked with the Department of Corrections, and we'll have some amendment language for you hopefully today that we can provide. That would simply change a tiny piece of the first section of the bill that would say that individuals that are registering to receive a medical marijuana card will have to attest whether or not they're under Department of Corrections supervision. So then when our agency receives that application, we could see whether or not an individual has attested whether or not they're under supervision or incarcerated. There's also the second section of the bill that talks about retroactively removing a card from an individual that has one if they become under supervision or under incarceration. We would then have the ability to promulgate rules under Health and Human Services that would say that would be one of the cancellation requirements for a card. And we would simply just receive notification from the Department of Corrections if someone were to go under supervision or became incarcerated.
So one question, just to make sure that I understand correctly, my understanding is that currently folks under the program are required to reapply annually. Is that correct? Just the cannabidiol program in general, not.
I don't have an answer for you on that today, Representative, but I'd be happy to get that for you.
I can tell you that.
Could the Department of Corrections come back to the table for a minute? The question that I have is, while I hear the concern of addiction and the use of the card, could you give us some more clarity around what the department has encountered, what the issues have risen up as, and kind of the reason for why this bill, you're seeing the need for this at the current time?
Especially the.
So the issue we're having is folks that we regularly do a urinalysis test on are coming back and testing positive for marijuana for pretty high amounts and trying to present the card. Some are coming back with gummies, saying that they're taking gummies, which gummies are not allowed under the statute. So it's really just, again, it's the loophole that the correctional clients are finding that's causing us the concern, because when they come in with higher amounts, when we're testing, that is beyond what would normally be allowed with a medical marijuana card. So that's really what was driving our concern, and it's really is a statewide issue for us.
Is there any potential way to segregate out the population that is effectively using this for a medical condition authorized by a physician? Would you have knowledge of how you could make sure we're not taking this away from someone who has a bona fide reason to have it?
So when it does occur, what's happening now, the clients are presenting the card to us, and that's how we're really become aware of it. And so if there is truly a medical need, then we're willing to work with that client on a case-by-case basis to get the medical condition addressed.
Would you be open to a part of an amendment that might suggest that that would be a requirement for the parolee or the individual under your supervision to somehow have to do an attestation or present medical rationale for the use of the card at some certain point of entry?
And I think that's kind of where the conflict comes in, because once they get the card issued, then it's supposed to be honored as them having a condition. So that's kind of, yeah.
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 All right. Thank you. Thank you, Mr. Chair.
So I share a lot of the concerns that were brought by our folks from mental health advocates and MedFarm that, oh, sorry, that this program is designed to help folks who are seeking treatment for a medical condition. I have personally family members who live in other states with slightly more functional programs who have been directly benefited from these programs in terms of their sleep, in terms of their pain. And so I have real concerns, particularly in the light of the existence of the opioid epidemic, of taking away access to something that might be assisting someone with pain control without them going to opioids. The fact that someone already has to reapply annually for the program, to me, suggests that we don't necessarily need to be concerned that someone is, for example, sitting on one of the things that was brought to me and kind of looking into this bill was like, well, somebody might get approved for it and then they don't really need it anymore. Well, they already have to reapply annually. So I understand the concern and like wanting to address abuse, but I'm not sure this is the way to go about it. And I'm really concerned that we're going to be hurting more people than we're helping if we pass this along.
Oh, yeah, thank you, Mr. Chair. I'm still trying to wrestle with how we can make sure we address your need as the Department of Corrections and also address the need of those who need it. So one of the other, I guess, questions I might have, is there a way, trying to figure out how to articulate this, is there a way that when someone tests over the amount that they should be testing for the card, that it's automatically removed at that point? And anyone who tests within the limits of what would be normal as having that card is a non-issue. Because you brought the issue of the abuse and the high indicators in the blood system or in the urine. I don't know, I'm just throwing ideas out to try and figure out how I'm willing to sign off on this bill to keep it moving out of subcommittee. I think this conversation needs to be continued to be had, and I'm also concerned about the addiction issue and how we make sure that we're helping the Department of Corrections in this process. Dane's got a question, Mr. Chair.
If I may, your question.
Thank you, Representative Fry. I don't know enough about how testing might work to be able to make that kind of verification that you're asking. But, to the department's point that was brought up, I think at the beginning about some patients, having a gummy in their possession, that of course isn't allowed as a form under our program. Or, to concerns about, they have a card, but maybe they're just using recreational marijuana that they're buying from some other source besides an authorized dispensary. I mean, one way to maybe potentially to address the concern you're raising and maybe the department's raising is to share purchase data with the department. Because the Department of Human Services right now tracks purchases for all patients when they come into the program. They hand them a card, it gets scanned. How much did you buy? And we all know that, or the department can know that based on the seed to sale tracking system, which tracks purchases also by patient. So I would think perhaps one way to maybe go after this would be to say, okay, well, if you've got a card and you haven't bought anything for 6 months from any of the 5 dispensaries, it's pretty clear that if you're testing positive at this point, 6 months after your last purchase, for example, that it's probably not coming from an authorized dispensary, and your card is just something to give you an out to use recreational marijuana and get away with it under your parole supervision. That might be one way to do it. I don't know how the department, DHS would feel about sharing that data, but I know that data is available within the department.
What are your thoughts on that, Nick? Well, unless there's any other comments from anybody, okay. I think we'll move this with a recommended amendment, obviously, because we're waiting on DHHS language anyway. But I think if we were to bring this up to committee, we would have to try to find a way to allow those with legitimate medical issues to remain on the program. So if you could help us with that, Mike, if you have any ideas, obviously Nick and Dane, we can continue to have that conversation. But thank you for your time this morning, and we'll go ahead and adjourn this meeting.